Hello everyone, my name is Dr. Igor Atabekov. I'm clinical oncologist practicing since 2010. Today I'd like to talk to you about cancer prevention or decreasing risk of cancer. We know that cancer risks may be modifiable, meaning that we can actually decrease the risks by doing something, by changing our lifestyle, for example. And our food, our diet is very important in modifying this risk. We know, for example, that a high intake of fruits and vegetables will decrease the risks of cancer by 15 to 20%. And here you can see in this systematic review and meta-analysis, the authors, they were trying to find out if intake of mushrooms, regular intake of edible mushrooms that are edible plus medicinal, like for example maitake or shiitake, can help to decrease the risks of cancer. Systematic review or meta-analysis is the highest level of scientific proof, and they take a lot of investigations and studies, and they search which one are good quality, they throw out all the rest, they put them together, they try to find what is, and they try to analyze and find out what is the general conclusion of all these studies. And these scientists came to the conclusion that regular intake of mushrooms will decrease risks of cancer in general, and most effect was seen in breast cancer. Now, maybe because the breast cancer is mostly studied type of cancer together with mushrooms. Why does it happen? First of all, mushrooms are high in antioxidants. We know that chronic inflammation or free radicals, they cause many problems, many chronic diseases like atherosclerosis, heart problems, strokes, diabetes, and even cancer. That's why if we take some food which is rich in antioxidants, it may actually neutralize free radicals chronically, and it may decrease the risks of cancer. Also, we know that mushrooms are an important source of beta-glucans and other substances that are immune modulators. They help to improve our immune system to protect us from cancer and from different viruses, for example, that also can cause cancer. I'm talking about papillomavirus or some types of herpes viruses, or for example hepatitis virus, and also they have a direct action against these viruses. It's very important. Next, they also modulate our microbiome, our flora in our guts, that is responsible for our protection, immunity, for normal work of gut barrier, and for normal work of all our organs, even our brain. Even mood depends on our microflora. There is one substance, ergotineoin, that is also a good antioxidant, and usually sulfur-rich mushrooms are a good source of this substance that really can decrease risks of, for example, atherosclerosis and heart and vascular problems. And that's why medicinal mushrooms and edible mushrooms also, they are an interesting remedy to not only to treat cancer, because we know that they can really help cancer patients, but we talked about it in separate videos, but also to prevent cancer and to decrease the risks of cancer. That's why in general I would say that it's a good choice for people to add these mushrooms in their diet if they have no contraindications or mushroom intolerance that is individual. Dear friends, that's all for today. Hope it was interesting. See you. Bye-bye.